Okay, we are good to go.
Great. Thank you, Katie. Welcome to the second Work Plan Development Work Group. My name is Morgan Cowling, and I'm the Executive Director of the Universal Health Plan Governance Board. Just a reminder that these work groups are an opportunity for the Governance Board members to discuss topics in a public meeting. Public members are invited to listen, but not actively participate. If you have comments on these topics, you're welcome to provide public comment in writing or in person or virtually at the board meeting next week. Written comments need to be submitted 72 hours prior to the meeting for board members to have time to review. The goal today is to get through the content so we can cancel the third meeting of the work group. But we do have that available and scheduled for Monday afternoon if we have more to discuss. Katie, would you do roll call?
Yes. Helen Belanca.
Here.
Warren George.
Here.
Debbie Diaz.
Present.
And then Cheryl is here. She raised her hand to signify that she is, and I'm just working with her on the audio and video behind the scenes.
Thank you, Katie.
That's everybody for now.
Would you move this slide along? Great. So today on the agenda, we have welcome. We'll review and discuss changes to the work plan since the last meeting. We'll review some the draft committee charters, what's included in them, and talk about the committee membership in particular. There's some questions in the slides to walk through with you all. And then we'll clarify next steps, either for the next work group meeting or for the board meeting if we get through the content today. So just a big picture overview of the work plan phases. First, we're in phase one right now, where we are building the foundation for the Universal Health Plan Governance Board for the work throughout. We're bringing content around single payer systems, what's happened in other states, at the board. And then the majority of the time will be in phase two, which is in proposal development. We'll get started in July with the committees working on the actual Universal Health Plan proposal. You can see we've included on this slide the status reports to the legislature in December of 24, December of 25, and then the final report to the legislature in September of 26. And then the final phase is working on the final report, and there is some additional kind of community outreach and sharing of the report included in that final phase. Next slide, please. So here's a more detailed work timeline for phases 2 and 3, the proposal development and the final report development. Some of the feedback that was given was to add a communications work stream and a transition plan work stream. So we have included those 2 new work streams to this timeline. We also had a recommendation to move up the community engagement and communications work streams. So they are reflected in work stream 1 and 2, not 5 and 6, and you'll see that reflected in this timeline as well. The other feedback that we received at the last meeting was to start all of the phases of work much sooner and to not have kind of one lead to the next, but to start them and have them run simultaneously and then work to make sure that there was good communication between the work streams and the committees. Katie, would you move to the next slide? So this is a new visual that captures the work streams, but also assigns each work stream to a committee. So at the last work group, there were 2 new work streams that were added, the communications and the transition, but we added those to include to be added to an existing committee that was suggested. So while there's additional work for that committee to take on, We thought that the work was aligned enough that it would be, it could be included in that committee. This visual also captures the expertise that we will need in our committee membership or in bringing outside expertise to the committee. And then as we're thinking through the support for each of the committees and the work streams, Jenny and I have been talking and with our OHA partners about how to staff those committees within the staff at the Universal Health Plan Governance Board and with the OHA policy analysts that will be coming on. And then you'll see I have a place here for a board lead. And I think that Bruce made a recommendation that if we open up the committees to members outside of board members, we would want the chair of the committee to be a board member to make sure that there's really good communication between the committees and the board. And then last, you'll see the committee assignments for each of those work streams. Any questions here before I move on? Okay, next slide. So a couple of questions that I wanted to work through with you all today. So there are two new work streams, the transition and implementation and the communications. We didn't talk a lot at the last work group about what needed to be included in there. So a lot of that content I either got in feedback from you all or in kind of thinking through what would be a value in that work stream. Is there anything missing that we need to capture and put in the work stream?
I think we might need to see it again.
Thanks, Katie. So to try and make this not tiny writing, we only included the deliverables. So because the communications and community engagement work streams were together, we included those deliverables. You'll see the communications deliverables include a communications plan with a suite of materials available for that outreach and engagement. And then I put a minimum of 10 presentations on the plan and then a dissemination plan. So after you all work to develop the Universal Health Plan, that there's a plan included there to get out the word and to talk about the plan. Bruce.
Yeah, I just want to be certain that in communications, a communications plan sounds very generic to me. I don't think we just want a communications plan. I think what we also want is some clear help in understanding what sort of messages are going to be important to different segments of the population. I just want to be certain that that work is included in there.
If we called it like a messaging strategy.
Yeah, how we talk about this is really important.
Yep.
And I would hope that they're going to do some things like have some focus groups and some other ways that we'll get information about how best to communicate.
It's a really difficult topic to communicate well about, and how you talk about it to different audiences really matters.
Thanks, Bruce and Helen. Cheryl?
And I think to those points, and I couldn't bring up the timeline. I can't find it in my materials, but I think it's really important for us to have started at least the work on the work stream 3 and 4, the finance and revenue and plan design and expenditure. Based on our experiences with the task force, there were a lot of questions, you know, various industries, various populations had that we couldn't answer at those community engagement sessions. So I'd really like to be prepared for how that, you know, so that we can show them how it pencils out, you know, in terms of especially the finance and revenue, I would say, more than anything.
And the finance and revenue and the community engagement are the two that start just a little bit earlier. It's staggered a little bit more for staffing reasons than for content reasons, which what the last version I think was more, the staggering was more based on content. And this is just to get to going as soon as possible. The community engagement and the finance and revenue, and then quickly bring on the other work streams as well. Morton.
To points raised, I think when we get into the individual work stream, there is certainly identified the need for public engagement and discussion with the public on things like what kind of taxes or revenues are preferred, or and I think that some of these individual committees are very respectful of the need for working with the communities to be sure that we're designing something that is going to be have the maximum chance that people will identify with it and feel like they own it.
Bruce.
Yeah, two questions. Well, two question and a comment. The question is, the community engagement and communications work stream, which are both part of the same committee, and the operations and transition plan, are we envisioning all the same people doing those? So the same committee that's going to do community engagement is actually also going to do communications?
That is the proposal. Yes.
And we don't think that that's going to be asking a lot of volunteers to do two of those at the same time. I'm just raising the question, and the comment I had is, I think the transition work stream has been short shrifted and needs some more time. I think that's a lot of work. I think no matter what we do, having a clear and well thought out transition plan is going to give people confidence. You can't make a change this big and sort of gloss over how you're going to transition from a system of today to a system that affects every single Oregonian in a major way.
Yeah, and with the addition of outside experts and consultants, so there will be some expertise, I think, on the committees, and we're hoping to pull people onto the committees who are willing to give their time, of course. But then I think this is where some of our paid consulting comes in, and the committees can advise us where we need to pull in a paid consultant. And a communications consultant is a great example of that, where we could say this is a task that needs, somebody, a contract and somebody's paid time. And same thing with thinking through the transition, that might be something we put money toward to get that done. The committee would probably guide the work, but I can imagine we'd have some paid people in there too.
Got it.
Thanks, Bruce and Helen. Given what Helen said with the, volunteers on the committee and identifying consultants to bring in, which I think is a underlying approach for this, that the the legislature gave the governance board resources to bring on contractors for this. Having the work plan is the essential piece of then using that and figuring out where do we need extra expertise to get this work done, I think is an approach and that I'm using to staff this work. Do you think that the communications and community engagement, they seem connected enough that you would need the materials to help provide and do some of the outreach or the listening sessions? So they seemed connected in my mind. We wanted to have the right materials for the right outreach. Bruce, I think there's a question back to you. Do you think that they're separate enough that we want to pull them apart in this work plan?
No, I don't, that doesn't, I think they are somewhat related. I was just making the comment about what we're expecting of the committee members and whether we were having the same people doing two tasks. If we think we can do that, great. I just have a little bit of concern about what we're asking of volunteers, but we'll see.
Debbie.
And then this may just be for my clarification, but I guess in my mind, when I was looking at this, I was thinking of the community engagement piece kind of coming prior to really the communication part. Like, just in my mind, I think of that, like, as Cheryl mentioned, like, we need to have some information of what we're communicating. So I guess I'm wondering if these two parts are being done simultaneously, or if it is staggered within more. It just seems more staggered, at least based off the timeline that you put out. But yeah, it seems everything is so interconnected. It's hard to think of them as separate things and identify like what to prioritize first within them.
Yeah, I think what I heard at the last work group meeting was that the community engagement really wanted to start with listening, and not the talking piece, but the listening, and to try and use and what I tried to reflect in the work plan was using the community engagement that's already been done. So not asking communities to continue to provide information. And talking with Michelle, she also suggested there might be other places where the community engagement can look for values and thoughts on healthcare access, whether it's community health improvement plans or community health assessments, that there's information that communities are collecting in addition to the community engagement that's already been done. So starting that community engagement with the listening part, and then working to identify what are the materials that might need to be developed to do more of the other engagement, and then working with the other work streams to do that engagement specifically around the goals of those other committees and those other work streams.
Yeah, if I can jump in, I think it's similar to the operations and transition. Like, the operations group would be the ones talking to OHA and Treasury and Department of Revenue, and really trying to get a lay of the land on what's going on now. And if we were to move to this, what would it take to get from what we do now to this other plan? What we need, what is the information we need to develop the plan, and then how would we get there? And so I think there's going to be kind of a natural piece in there for the operations team to then be aware of all the steps that are needed for a transition, and where we're going to need to put a whole bunch of resources versus having the agencies kind of work that out on their own. So yeah, they're the ones really connected with the state agencies and the Treasury and OHA. So it made sense to us that the operations group would have all of the pieces to think through what's needed for a transition, and then distribute that work kind of accordingly, depending on what they learn in the process.
So any other thoughts or feedback right now? Katie, would you go back to the questions slide, please? This one, yes. So I also wanted to ask a piece of feedback we received at the last meeting was to make sure there was enough listening in the community engagement work. And I checked in with Michelle, who wasn't able to attend today, but did provide that comment, and she thought that there was and appreciated the edits that have been made, but I wanted to check in with the group to see if there was any more language that we needed in the community engagement work stream particular to reflect that listening piece. Okay. Oh, Bruce.
One more quick question. I just, I may have missed it. Is in which work stream is, there gonna be work about how this new system controls costs?
That's gonna be plan design and expenditure. It's
Okay.
it's buried in the first bullet. It's
Oh, I see it. Thank you. My bad.
No, it's okay. It's a lot.
Cheryl.
I was pondering your question about whether there was enough listening and community engagement work, and I felt like maybe we fell short with some of the community engagement sessions in our task force. So I think that we haven't heard from, I don't think we've heard, we haven't had enough representation from certain populations, I would say. So, but to your, you mentioned that we could use, plans, community-based plans that from I would guess from hospital CCOs, public health departments. So maybe that will get to some of those gaps. I don't know. So I just wanted to respond to that.
Are there particular gaps you wanted to call out, Cheryl?
Well, behavioral health.
Yeah.
Of course I'm going to say that.
Yeah. So are you referring to the population of folks needing behavioral health services, the community of clinicians and providers, everybody?
All of them. I think, I know it's very, very difficult to recruit people to talk about their experiences in the behavioral health system for a variety of reasons. But I think it was skewed to very young people, maybe who were going to college. And so I think that we need to hear from others besides that particular population. And I honestly don't know. I mean, I wasn't at all of the community engagement listening sessions, but I don't know if we had really any behavioral health providers that, I don't know that we talked to them at all.
I agree, Cheryl.
Well, one of the tasks, and I think this was also part of a suggestion that was made at the last work group, was to identify strategies to engage with communities and stakeholders using existing structures and meetings, so that we didn't want to keep going back to the same populations. And what I'm hearing from Cheryl is that it's a missing population, but we didn't want to keep going back to the same people and asking for their input again and again without looking for other places where they've already given input. So I think there's kind of two ways we could approach this, look for existing structures to engage with missing populations, but also to look at other areas where folks have already given feedback, and that might be another way to approach that. Yes, Cheryl.
I just thought of another population that there's probably a gap, and that's for dental care. And I just want to call out the House Behavioral Health Care session during legislative days. They had like a 90-minute session on dental care. I learned a whole lot about gaps in dental care coverage and payments. I thought it was very instructional. About how the current system pays for dental care or doesn't. So just want to put that out there too.
Thanks, Cheryl. Well, I've captured some more feedback. I just wanted to, there's two other pieces where there were changes from in feedback that we received, moved the federal waivers work from the plan design and expenditures to operations, which seemed to align with a lot of that agency work that Helen was just talking about and working with the Oregon Health Authority. And then a couple of missing pieces that several of you gave in feedback, added tasks addressing quality of care and workforce into the plan design and expenditures. The only place where workforce had been included was in the transition piece. And I received feedback that it needed to be in another location in the there wasn't enough to think about it at the kind of the end and the transition piece. We needed to think about it earlier. So I just wanted to see any additional feedback around those changes or anything else that's needed to reflect those suggestions in the document. So those are the specific questions that I had. I've captured the feedback that's given. Is there any additional feedback or thoughts that are needed, changes in the work plan before it goes to the board? Warren.
I think there are a couple of things that, oh, I'm echoing. I think there's a little bit of, it's not really clear to me, the cost reduction plan, looking for the savings. I think there are some elements of that in finance and revenue, and there's some elements of that in the plan design. And you know, I'm not objecting to going forward with this, but I think there has to be, we work some things out on the go, because I think some of that will become clear to us as we get further in, and I'm anxious enough to get started that I don't want to spend a lot more time on the design of this. The other thing that I would say is I think it's really important as we build these committees that they will, we're going to have not only the expertise of board members, but some outside people who might be able to better refine the tasks of each, and you know, subject to board approval. We don't want to get into arguments between committees, but I think those committees on their own should have some opportunity to better define the tasks, subject to board approval. And I don't expect huge need for that. I think it would be constructive and kind of help with the community ownership of their tasks.
So I heard a couple of things. One, kind of thinking about the moving into the work of the committees, that part of the work would, the beginning work of the committee would be to review the tasks and deliverables and see if there's anything missing. And if there was, kind of go back to the board for additional suggestions that need to be added to those pieces.
That's a good restatement.
Okay.
Thank you.
I will figure out a way to put that into the committee charters, because I think that's more of a process piece for the committee charters as a suggestion. And that's a great transition. If there's I'm just gonna, before we move on to committee charters, any other feedback for the work plan? Okay, moving to committee charters. So this is kind of, the committee charters is kind of moving the work plan from theory into action, where there would be a committee of people that would be working. There are the 4 committees. So there's our charter for each committee: the community engagement, plan, design and expenditures, finance and revenue, and operations and transition. Each charter has tasks, deliverables that are just pulled, at least right now, straight from the work plan draft. Excuse me. It has the staff assignments. It has some process considerations, especially where there's connection between the community engagement and the finance and revenue. It kind of calls out that connection so that that is clear. A little more thinking around the timeline that I think still needs some work, and subject matter expertise and resources needed to fulfill the tasks and objectives. And then at the beginning of each committee charter, there's the board members and including the chair, which I think was a suggestion Bruce made at the last work group meeting, to make sure that the chair of each committee was a board member, to have that good connection between the committees and the board. And then non-members. Is there anything missing, just like big buckets, that we want to include in these committee charters?
I like the fact that you have tied the deliverables to the Senate Bill 1089 chapter and verse.
Thank you. So then I have some questions to think through about the membership on the committees. That, you know, this is a new idea. I think having non-board members on the committees. Do we want all 4 committees to be made up of board members and non-board members?
Yes.
Yeah, I can't think of a reason why there would be a committee that wouldn't include that. I would say yes.
Makes sense to me.
Is there a recommended minimum number of board members that you would like to see on each committee? Or a maximum? Would you like to think about how many board members on each committee?
I think there should be a minimum of 2, at least, and we have to respect that we have board members who are already quite busy. But hopefully we could get 2 pretty active board members and some additional help when people can provide it. But I think a minimum of 2.
That seems right to me. My question is, if we don't have 2 volunteers for each of the 4 groups, is this something where we would assign board members, or just leave it entirely voluntary and then kind of address the fact that there's only 1 board member on one of these committees or more?
I think we look to your powers of persuasion, Helen.
Trouble.
Well said, Bruce.
I think 2 minimum makes sense. It would be nice to have 3, but given that there's only 9 of us, I think 3 is a big ask. But if we had 2 board members on every committee, and if we don't have immediate volunteers, then yeah, trying to coax them.
Okay. And then is there a recommended number of total members on the committee? And I've heard two ideas that they should be small and nimble, kind of 4 to 6, and that they might want to be larger, kind of a 6 to 10, to bring in more perspectives and more people to help provide input. Any ideas from the work group? Cheryl.
6 to 10 sounds right to me. That sounds like a good group. And honestly, I mean, speaking of the busyness of people, it's been really difficult for me. I know Katie painfully knows this, for me to even figure out days that I can be at these work group meetings. So I think a lot of us are in that same boat, as well as volunteers, I imagine. So just to have enough people so that if a couple can't make it, you still got a decent amount.
Thanks, Cheryl. Bruce?
I'd be less concerned with size and more concerned with perspective and expertise, and having enough people that will bring a rich series of background issues, expertise to the group. I would probably err for bigger rather than smaller for exactly that reason. But I think that I'd be concerned with too small a group, and that group not being diverse enough that it brings the kind of perspective that we need.
Thanks, Bruce. Warren?
I was going to say something that I wish I'm not going to like what I'm going to say, but there is the issue that we might be able to squeeze a little more time out of people with evening schedules, or if we could have some meetings in the evenings. I know these are staff. Can be staff issues, or maybe some Saturday mornings or something. It's just a thought. Like I said, I didn't want to say that, but I mean, it is something that I guess I'll put the question to you, Cheryl, since you are one of those people, and I suspect you're jealous. With that schedule you have, you're pretty jealous of evenings. And
Well, frankly, and don't throw tomatoes at me, anybody, but I'd be willing to do evenings to squeeze it in, honestly.
I appreciate that.
We also talked about sort of an idea of that not everyone's participation needed to be contemporaneous, in the sense of we could have some sort of publicly posted discussion board where we're trying to sort through a question or an issue, and we would invite people to weigh in when they have time in writing online, and just kind of post it so that we could capture people's ideas and perspectives, even if they couldn't attend the meeting, and just making options like that available to maximize, everyone's chance. I think we are, it will be some sort of virtual meeting of some sort where we're trying to be at the same place at the same time so that we can discuss things with each other, but having an option to participate not contemporaneously would be also useful, I think.
Debbie?
I would just add that I would also be able and willing to do evenings. I'll be having a new clinic schedule starting next month, and that will limit my kind of normal business hour availability quite a bit. So that would be helpful, especially if there's a limited number of board members on the committee and we want to ensure that we've got presence.
Thank you.
Great. So I mentioned, I think that there's still work that needs to be done on fleshing out the timelines for these committee charters, but did want to share the direction that they're going to go right now, trying to get a little more detailed, and making sure that we have the right content and expertise to support each of these committees. Any other feedback on these committee charters right now? Cheryl.
I think one question I have, I'm not quite sure how we'll handle this, but I know just for myself, there are two committees that I really want to be on and two that I don't want to be on. I wonder if there will be like 6 of us wanting to be on one committee and not so many people wanting to be on others. And I mean, we also have our passion and expertise too, that we want to use. So just saying, I don't know how that's gonna all fall out. Maybe it won't be a problem, but I'm just wondering about that.
Helen will help figure that out.
Yeah,
And I, as vice principal.
yeah, I'm not sure how that's all going to play out, but we'll get a sense of people's interest once they see how the work plan is laying out. And I like, really focusing in on what this committee is going to be charged with doing. And I think people will sort themselves, I hope. Yeah, we'll see how it goes. And then we might need to do some shuffling afterwards.
I'd just like to have Bruce say a little bit about what it was like to staff the original committees of the task force.
There's a lot of work. And, I think that we've got to be well organized, and by doing that, I think we can get through things, but it's a lot of work.
Yes. Every time I look at this work plan, there's a lot of work in all of these work streams that needs to be done.
Big creative
So-
ideas like evening meetings and other things are good and will help.
So any other feedback right now? I captured the work plan feedback. I will make those changes. I will reflect Warren's feedback and add some language around kind of minimum numbers in the charters to start including those pieces. My next steps would be to make those changes and to post them available so that that could be discussed at the board. Based on the feedback today, it doesn't seem like we need the Monday meeting unless you feel like you'd like another look at the changes before they go to the board.
I agree.
Yeah, I don't think we
I'm
do.
fine with canceling Monday.
Great. The other two pieces for the board meeting discussion, especially around the committee charters, want to have some conversation about timeline and process for a recruitment for non-board members to the committees so that we can start thinking through the steps that would need to happen and maybe if the board is ready, recruit for at least the board liaison or chair for each committee and let folks think about what other committee they may want to be on so that we've got a lead for each committee coming out of the board meeting next week. How does that sound?
Good.
Anything else we want to make sure? So the work plan changes will be made. We'll have the charters available, but the charters conversation will be around recruitment for non-board members and recruiting a lead for each committee. Anything else that we want to have during those two agenda items for next Thursday?
Will we be approving the charters and the work plan? Is that the goal?
they are both listed on the agenda for a potential approval. The work plan, so both is up to the board. I think that the work plan will be ready for approval based on 2 meetings and feedback for it. I think that what I heard is that the charters might need some more work, and we might want to appoint the people when we approve the charter. What I think is that we might want to appoint the people and approve the charters at the same time. But if the board would like to approve the charters kind of subject to some changes and recommendations from the committee, that would be an option as well.
And I would support that to get launched on these things.
Is it possible to approve a draft charter? Is that a thing? Could we say that this is like sort of a working charter right now, and that whoever the board liaison is for this committee, they're gonna, put a second set of eyes on it and really go through and make sure that we've captured what we need to capture before we finalize it? Because I'd like some more input on those charters, and I think the people who are going to be, the leads on those committees should be, given, a little bit of time to add to them or refine them a bit before we approve them and recruit based on them. Can we do that? Can we recruit draft charters, or can we just delay it? I mean, should we approve draft charters or just delay it until later?
No, I think that's a great idea. I think that these charters actually should be living documents that will change, because I think that we're going to find that there are issues that come up that aren't, quote, in the charter. And I would hate to see anyone say, well, it's not in the charter. So I think that we've got to view these as documents that are iterative. And so if we view them as iterative, then I just think we can approve the first draft and go from there.
Okay, good.
Great. Well, I will make the changes to the work plan. I'll make the changes to the charters. They will be posted on the website for discussion at the board meeting next Thursday. We will cancel the Monday work plan, and I will also include a draft timeline and for a recruitment process for getting non-committee members as well to discuss during the committee charters agenda item. Anything else you all need for these conversations for the board meeting next Thursday? Great. Well, thank you all for your feedback and thoughtful conversation today. And I think these documents will be better for having had this work group take a look at it. So thank you, thank you, thank you.
Yeah, and I just want to jump in and say thank you to Morgan and Katie and Laurel and Devlin and Jenny and everybody who worked on these too. They put in enormous amounts of time, and I think they look really great and are going to help us a lot. So just thank you so much for all your work on this. It's really outstanding.
Thank you. Thanks, everyone. We'll see you next Thursday.
Thanks, Morgan. Bye, everyone.
Bye. Thanks, everyone.
Thank you.